landscape of breast cancer treatment is undergoing a paradigm shift, fueled by the emergence of CDK4/6 inhibitors. These targeted agents represent a significant advancement, altering the clinical course for patients with estrogen receptor-positive advanced breast cancer. Mechanistically, CDK4/6 proteins act as crucial regulatory elements within the cell cycle, dictating when and how cells divide. By interfering with their binding to DNA, CDK4/6 inhibitors effectively halt cancer cell proliferation, impeding their relentless expansion. Clinical trials reveal a further compelling story. In combination with standard endocrine therapy, CDK4/6 inhibitors significantly extend progression-free survival and reduce tumor burden compared to endocrine therapy alone. Furthermore, these agents exhibit a manageable side effect profile. Though challenges remain. Some patients develop resistance to CDK4/6 inhibitors, necessitating further research into overcoming this limitation. Additionally, optimizing patient selection through robust biomarkers will maximize the therapeutic efficacy of these agents. The frontiers extend beyond advanced stages, with ongoing clinical and preclinical studies exploring their potential benefit in earlier settings and even other cancer types. The emergence of CDK4/6 inhibitors marks a pivotal moment in breast cancer treatment, redefining therapeutic strategies and offering new hope for improved outcomes.